Namaste. Good morning. I am Dr. Rohan Parikh. I am an interventional cardiologist at Olympus Heart Center, which is affiliated to Akanksha Hospital and Research Institute, Anand. We have just listened to our Honorable Prime Minister Shri Narendra Bhai Modi, who has all enforced us to continue this lockdown. I, on behalf of Akanksha Hospital, want to thank government authorities, Indian Medical Association, Anand Branch, President Dr. Sujay Joshi sir, and Secretary Dr. Ritesh Prajapati sir for conducting and helping us in continue our essential medical services in this time of lockdown. Today, my talk will focus on preliminary aspects of healthy heart. If you think of health, you think of heart, isn't it? Healthy heart, as you understand, cardiovascular disease is the number one killer in the world. In India, 31% of deaths are due to cardiovascular diseases. Out of this, 50% of cardiovascular diseases, it is ischemic heart disease or coronary heart disease or heart attack, as one commonly understands. Of these heart attacks, some 11 to 15% of patients suffer sudden cardiac death. This may be the first and the only symptom of the underlying serious heart disease. Shocking, isn't it? Now think wisely. Whenever you hear someone talk about healthy food, exercise, yoga, meditation, stress-free behavior, which organ of the body they predominantly want to address? In this era of technology, you see many people wearing fitness band, wristbands, all the smartphones, whether Android or iPhone. You have an inbuilt health application. This health applications, wristbands calculate your daily footsteps, calorie intake, calorie burnt, heart rate, blood pressure, oxygen level, etc. All this directly or indirectly monitor function of your heart. All forms of yoga, physical or otherwise, address your heart. All meditation or relaxing techniques act on reducing the stress on your heart. Isn't it so? You watch televisions, you watch health shows, health experts talking on healthy diet. What do they want to achieve by healthy diet? They want to achieve low cholesterol, normal blood sugar, normal blood pressure. All this narrows down to heart so that your heart remains healthy. How do you know what is the status of your heart? How can you assert whether your heart is healthy or not? A healthy individual must be able to walk 3 to 5 kilometers on an average speed of approximately 6 kilometers per hour, or its equivalent like jumping, skipping, jogging, climbing stairs up to 2 floors. He must be able to do this activity without any chest discomfort or breathlessness. If you are not able to do this, consult your doctor. There is something wrong. Obvious symptoms of heart attack are chest discomfort at rest, breathlessness at night, swelling of feet. Diabetic patients need to be more careful. They may not experience any of the symptoms I mentioned above, still have a serious cardiac issue. Post-meal discomfort or acidity or gas trouble may be the sign of serious cardiac problem in some patients. So, assessment is done in 3 tiers. How do you assess the cardiac status or your heart function? First and most important is assessment by a cardiologist. Second is blood investigations. And third is imaging, either non-invasive or imaging, that is invasive angiography or CT coronary angiographies. Most important in the prime step is assessment by a cardiologist. It is most important to look for clinical history to assess your modifiable and non-modifiable risk factors. What do you understand by non-modifiable risk factors? Non-modifiable risk factors are the risk factors where we cannot alter, we don't have any intervention. For example, genetic constitution of an individual. You may have inherited high-risk genes for heart attack from your parents or grandparents. We cannot address them. Age. Age is also one of the important non-modifiable risk factor. As age increases, not only your hairs grow gray, your knee starts aching, but also your heart and blood vessels get old and tired. Doctor can assess them and stratify your risk level. If your clinical assessment suggests need for any blood investigations or imaging, then doctor will suggest you the same. Putting everything together, clinical risk and investigation, a doctor can decide whether you need lifestyle changes, medications or further treatment in form of angioplasty, that is stenting or bypass surgery. Investigations in absence of clinical assessment has no meaning. I want to stress this. Modifiable risk factors, the other part, modifiable risk factor means where we can intervene and reduce the risk of heart attack. What are these? High cholesterol, uncontrolled blood sugar, uncontrolled blood pressure, sedentary lifestyle, addiction to alcohol, smoking or consumption of tobacco in any other form, stressful lifestyle, poor dietary habits. What can we do to address this? Diet rich in proteins and fibers, fruits, nuts, almonds, low salt, all this can help. Consume more of vegetables, dal, less of roti and chapati or rice. Avoid simple sugars like sugar in milk, tea or coffee, milkshake, chocolates or ice cream. Have plenty of salads, cucumber, tomatoes, onions, radish. Avoid using table salt or chaat masala, which is typical of Indian dietary habit. Do regular exercise of at least moderate intensity for 15 minutes a day for 5 days a week. This can be in form of running, jogging, skipping, swimming, treadmill or aerobic training. Restrict weightlifting or resistance exercises to less than 30% of the total. Perform regular yoga or any form of meditation which can reduce your stress. Now this is up to you. You do the activity where you feel relaxed. Doing pranayama may relax your friend's mind, but not necessarily yours. You do what you are comfortable with, where you feel completely stress-free and relaxed. True form of meditation, I believe, is to develop your mind in such a way that you feel stress-free and enjoy in whatever activity you do, no matter what, whether it's your office work, household duty, or simple thing like having your breakfast. Do not use Google every time. Despite doing everything of the said above, or if your clinical assessment points to a higher risk, doctor suggests you medication or he might suggest you an intervention. Here also don't use Google to decide merit of the drug therapy prescribed to you by your doctor. Super specialty degree in cardiology require 12 years of medical school and hospital training. What you read on internet is just the basic information and you need to put clinical context in addition to that, for which you need to have medical training. One more important point which I think everyone of us should know, medical record. Medical records are very, very important. May it be your vaccination you received in childhood or any blood test done in the past for minor ailments like heart, like fever, malaria, typhoid, or surgery you have undergone in past pertaining to heart, stents, valve surgery or bypass surgery. Any patient who has undergone a surgery in the past, for me it is vital to know which stent was used, what was the size, what was the class, what was the generation of the stent used, if bypass surgery was done, what was the graft used, whether legs from the vein were used or arteries from inside the chest were used for bypass surgery, what was the status of your heart at the time of surgery. Always make it a habit that whenever you go to a doctor, make sure you carry all your past medical documents. This can help easily decide your treatment. This can also help save you a few bucks, avoid unnecessary repetition of tests which you already might have undergone in the past. Summarizing, heart diseases are the leading cause of mortality worldwide. It is important to keep checking if your heart is healthy because many a times it may be too late to wait for symptoms. Follow healthy diet, do regular exercise, and consult your doctor. Listen to your doctor carefully and follow him religiously. Let first doctor do the clinical assessment, and if doctor suggests, only then you proceed for investigations. Always carry past medical records while visiting a doctor. Stay healthy, eat healthy, do exercise, and your heart will remain healthy. This is all which I want to share as an heart attack preliminary things which a common man, which you and me should know. While we understand that heart attacks are commonly there in and out, you must be hearing in your society, in your neighborhood, either one or the other person has undergone stenting, has undergone bypass, or has suffered an heart attack. So it is an of utmost important. Heart attack is the number one killer worldwide and also in India. So stay healthy, eat healthy, and do regular exercise. That's all from me. Now we have some multiple viewers watching here a live show. There are a few questions also which have come up through Facebook comments and Instagram comments. I would like to address them. First, the one of these is Anita Bakshi. She has asked what care a patient should take if he has undergone angioplasty, that is stenting. She has returned stenting. Now, if you have undergone an angioplasty or stenting, for a common man to understand that angioplasty or stenting is a type of operation on a heart which is done without opening your heart. So it is a big surgery. You are cleaning your blood vessel, removing heart blocks so that your heart can function, it can pump, and there is no obstruction to blood flow to your heart. In deciding what the care an individual should do or exercise after following a stenting, we require to understand that we need to know what is his heart function, what is the ejection fraction, that is, what is the pumping capacity of his heart, which stents were used, in which artery the stents were used, what he has suffered, whether it was an acute heart attack that he had come or it was gradually progressing onset of symptoms for which he went to a doctor and then ultimately underwent intervention. All this information put together can help you decide his exercise capacity, his limitations of work or no limitations of work, and he can do everything after stenting. That depends on putting everything this into context. One question from Mr. Sunil Patel has come is, he wants to ask is, what is the difference between heart bypass surgery when from the vein from the leg or vein from the chest is used? Okay, so this bypass surgery means there is a blockage in an artery and you use a bypass conduit, you use a graft to bypass that block. That can be vein that are usually harvested, that are usually removed from your legs and that are grafted on your heart so that you can bypass the original blockage. Veins usually get occluded over a period of time. By 50% of veins get blocked at the end of 10 years. If the arteries from inside the chest are used, which in our medical terminology are called LIMA, left internal mammary artery, or RIMA, right internal mammary artery, their patency rate, that is they remain open by 98% at the end of 10 years. So it is always advisable that if feasible, the arteries from inside the heart are used rather than that from the legs. Still, there are table to table variations where you need a cardiac surgeon or a cardiologist will on table decide that what is better for that individual. In some very high risk individual, even venous grafting may help. We have another question, that what is the ideal frequency of cardiovascular exercise? I have told in the beginning, just to repeat it, ideal frequency of cardiovascular exercise is 15 minutes of moderate intensity exercise. Now, what is moderate intensity exercise? Just to clarify, we hear my parents, your colleagues, your friends, they always tell you that I go for morning walk. They walk for 3 km, 5 km for 2 hours and 3 hours. That is not useful. It has to be of at least moderate intensity. Your body should have sweating. You should feel breathless. You should feel tired at the end of that exercise. That is physical stress. That moderate intensity for at least 15 minutes, that has to be done once a day for at least 5 days a week. You can take weekend off. You just have to do that for 5 days a week, but that has to be a moderate intensity. If you put apart walking, jogging, treadmill, aerobic exercising, swimming, these are all moderate intensity by themselves. Walking, it has to be brisk walking, where you start feeling breathless and you are short of your breath for walking. After that, you have to continue for 15 minutes. Then it is a moderate intensity of exercise in form of walking. Another question is whether angiography is a safe process. Angiography, I hope the questionnaire wants to say the invasive angiography, where you put a catheter or a guide wire inside the heart, you push the dye inside the coronary arteries to look whether there are blockages or not. Angiography, every procedure has some risk. Angiography invasive, where you put a catheter inside the heart, it is a risky procedure. But for diagnosing heart attack, it is the most sensitive and a gold standard investigation to assess what has to be done further for a patient who has undergone a heart attack. It is mandatory for every patient to undergo coronary angiography if he or she has suffered a heart attack. More so, earlier the better. If patient undergoes testing, that is in form of invasive angiography, within first 6 hours of heart attack, then further intervention either in form of angioplasty, that is stenting, or bypass surgery can give you the best result and can save your heart from further damage. Delayed you present to a cardiologist, later your angiography is done in the history of heart attack, lesser the benefit you are likely to get from the treatment. So visit your cardiologist as early as feasible. Don't neglect any symptom. Don't try to label it as a gas trouble or acidity or just an epigastric discomfort. That may not be serious cardiac issue, but what is harm in asking a doctor? What is harm in asking an expert? We have cars. We regularly send them for a service 6 monthly, yearly. This is also a car. This also has a machineries. Of course, God is the best manufacturer, so it has given you the best parts inside, but they do need service. They do need an assessment. You need to visit your doctor as regularly as feasible, more so once you cross the age of 40 years. Now, I may want to make a point here. For an Indian population, it is more important. Indian or South Asian population are at a higher risk of heart attack than Western population. So, an individual, you might have heard that somebody at young age of 30 or 35 has suffered an heart attack. This is very common in India. So, if somebody from your family, your parents, grandparents have undergone angiography, angioplasty, bypass surgery, or have suffered some heart attack, or you don't know but they have some cardiac issue, make sure whenever you become sane, whenever you can take your decisions, whenever you individually move outside, you always make it a point that you visit a doctor once and then as doctor suggests. One of the important thing is always make sure that you don't go for directly clinical checkups in form of blood investigations. You commonly hear that people usually opt to a multiple corporate hospitals. They come and they opt for one of the health checkup plans where there are multiple blood tests. There is a menu like a restaurant where you have multiple blood tests given, multiple investigations given. Understand this. This test or investigations are only to support the clinical diagnosis of a doctor or to modify or add something to his treatment. So clinical assessment is the first and the prime step. You should not go for any blood investigation or investigation, may it be ECG, may it be echocardiography, may it be angiography, without an assessment of a doctor. If a doctor thinks it is necessary, then he will suggest you the same. Absence of clinical investigations without clinical assessment, they are too complementary, and clinical assessment should always be prior to clinical investigations. Another question is how frequently you should visit a doctor. If you have a serious cardiac ailment, where your heart pumping is less than 30%, make sure you visit at least 15 days or a month to a doctor, if not less. If you have undergone an angioplasty or if you have undergone a bypass, after surgery, usually we have a protocol to call the patient at the end of the first week, then at the end of first fortnight, that is after 14 days, then at the end of first month, and then every 3 monthly regularly. If you have undergone a bypass surgery, we usually call patient on 10th day after surgery to remove his stitches, look for the healing of wound, and then we advise him to follow fortnightly for 3 visits till the wound is completely healed. After that, 1 month to assess his function of the heart, and after that 3 monthly checkup. If you have undergone any heart operation, make sure at least 6 monthly or yearly your heart function is assessed in form of clinical assessment and an electrocardiogram, ECG or EKG as in US, and echocardiography is done so that you have an objective assessment of the heart function as well. It is important that you follow your doctor's instruction and continue the treatment as he advises. I hope this is enough for the day, and I hope my information would be useful to you and help you understanding what are the heart attacks and how to deal with it. Thank you for listening to me. Stay healthy, stay safe, do regular exercise, and do needful to the India. Thank you.